Did you know your pillow might be plotting against you? Now, before you side-eye your bedding, hear me out. Every night, you climb into bed, get cozy, and drift off without a second thought. But what if I told you that the way you're sleeping right now could be quietly sabotaging your health? We are not talking about losing a few minutes of rest here and there. We are talking about positions that can mess with your spine, strain your heart, disturb your breathing, and yes, even affect how your brain clears out the day's mental clutter. The wild part? Most of us have been sleeping the same way since childhood, never questioning whether it is actually good for us. It is like wearing the same pair of shoes for decades and wondering why your feet hurt. Tonight, we are going to walk through the 4 sleeping positions that might be doing more harm than good. And do not worry, I will also share the smarter alternatives that can help you wake up feeling genuinely refreshed instead of like you have been wrestling a mattress all night. So, if you have ever woken up with a stiff neck, a sore back, or that foggy brain feeling that takes 3 cups of coffee to shake off, stick around. This might just change the way you think about bedtime forever. All right, let's dive into the first position that's causing more trouble than you'd think. Sleeping position number 1, the stomach sleeper, face down and paying the price. Picture this. You are lying face down, arms tucked under your pillow, feeling safe and snug like you are hiding from the world. For a lot of people, this feels like the only true way to relax. I get it. There is something comforting about pressing into the mattress, like you are grounding yourself after a long day. But here is the reality check. When you sleep on your stomach, your head has to turn to one side, otherwise you would suffocate, which would definitely ruin your sleep quality. That twist in your neck is not just uncomfortable, it is putting real strain on your cervical spine for hours at a time. Imagine twisting your neck 90 degrees and holding it there while someone sits on your back. Not exactly a spa treatment, is it? Over time, this position can lead to chronic neck pain, pinched nerves, and even tension headaches that show up uninvited. According to chiropractors and spine specialists, stomach sleeping is one of the top culprits behind long-term spinal misalignment. And if you are someone who already deals with arthritis or disc issues, this position is basically adding fuel to the fire. But the problems do not stop at your neck. When you are lying face down, your chest is compressed against the mattress, which limits how deeply your lungs can expand. Your diaphragm, the muscle responsible for pulling air into your lungs, cannot move as freely. The result? Shallow breathing all night long. Less oxygen means your brain and heart are not getting the fuel they need to recharge, which can leave you feeling groggy, unfocused, and just plain tired even after a full night's sleep. And let us not forget about your lower back. Without proper support, sleeping on your stomach can create an unnatural arch in your spine, putting pressure on your lumbar region. Think of it like bending a paperclip back and forth. Eventually, something is going to give. So, if you are a dedicated stomach sleeper, I am not here to judge, but I am here to tell you that your body might be quietly asking for a change. Now, you might be thinking, okay, stomach sleeping is out. What about curling up on my side? That feels natural, right? Well, not so fast. There is a version of side sleeping that is actually making things worse, and you might be doing it every single night without realizing it. We will talk about that next. Sleeping position number 2, the tight fetal curl, comfort that comes at a cost. There is something instinctively comforting about curling up into a ball at night, knees pulled up toward your chest, arms wrapped around yourself. It feels protective, almost like you are creating your own little cocoon. And for many people, this has been their go-to-sleep position since they were kids. But here's the thing. While it might feel emotionally soothing, physically it is creating a few problems you may not have considered. When you curl up too tightly, your diaphragm gets compressed. That means your lungs cannot fully expand, which leads to shallow breathing. And just like with stomach sleeping, less oxygen means your body is not getting the deep restorative rest it needs. You might be in bed for 8 hours, but your body's running on half a tank of fuel. On top of that, staying in that tight C shape all night can shorten the muscles and ligaments along your spine and hips. Over time, this can lead to stiffness, reduced flexibility, and even postural issues. If you have ever noticed that you feel a little hunched over or tight in the mornings, this could be why. The National Sleep Foundation has pointed out that extreme curling can also put unnecessary strain on your joints, especially if you are dealing with arthritis or osteoporosis. And for those who already have breathing concerns like asthma or mild sleep apnea, this position can make things even trickier. Now, I am not saying you cannot sleep on your side. In fact, side sleeping can be fantastic when done right. The key is to loosen up that curl. Keep your body more aligned. Maybe place a pillow between your knees to support your hips and let your spine stay in a more neutral position. Think relaxed crescent moon, not stressed out shrimp. All right, so tight curling is a no-go, but what about the position that doctors used to recommend for years? Lying flat on your back like you are standing at attention. Surely that one is safe, right? Not exactly. In fact, for some people, it might be the riskiest position of all. Let me explain why. Sleeping position number 3, the flat back soldier, straight spine, hidden risks. For decades, sleeping flat on your back was considered the gold standard. Spine aligned, weight evenly distributed, textbook posture. And for some people, it genuinely works well. But for others, especially as we age, lying completely flat can introduce a surprising set of challenges. The biggest issue is gravity. So, when you are lying flat without any head elevation, your tongue and the soft tissues in your throat can relax backward and partially block your airway. This is what leads to snoring and, in more serious cases, obstructive sleep apnea. Sleep apnea is no joke. It is a condition where your breathing repeatedly stops and starts throughout the night, sometimes dozens of times per hour, and you might not even realize it is happening, but your body does. Every time your airway closes, your oxygen levels drop, your heart works harder, and your brain gets jolted out of deep sleep. Over time, untreated sleep apnea has been linked to high blood pressure, heart disease, stroke, memory problems, and chronic fatigue. According to the American Academy of Sleep Medicine, people over 60 who sleep flat on their backs without proper support are at a higher risk for these breathing interruptions, and many do not get diagnosed until the damage is already underway. But wait, there is more. Lying flat can also worsen acid reflux. If you have ever woken up with a burning sensation in your chest or throat, this might be why. When your head is level with your stomach, gravity is not helping keep stomach acid where it belongs. Instead, it can creep upward into your esophagus, causing discomfort, coughing, and even long-term damage to your throat and vocal cords. Now, does this mean back sleeping is off the table? Not necessarily. But it does mean you need to make some adjustments, like elevating your head slightly with a wedge pillow or an adjustable bed. We will get into the better alternatives in just a bit. Okay, so flat back sleeping has its pitfalls, but surely sleeping in a recliner where you are already elevated and supported must be better, right? A lot of people think so. In fact, some folks end up sleeping in their recliners every single night. But here is the truth: that cozy chair might be doing more harm than you realize. Let us unpack that next. Sleeping position number 4, the recliner sleeper. Comfort that quietly undermines your health. Let's be real. Recliners are amazing. They're soft, supportive, and perfect for an afternoon nap or watching your favorite show. And if you're dealing with back pain, arthritis, or acid reflux, that semi-upright position can feel like a lifesaver. But here's where things get tricky. When that occasional nap turns into a nightly habit, your body starts paying the price. First off, sleeping in a recliner keeps you in a semi-sitting position, which restricts blood flow to your legs. Over time, this can lead to swelling in your ankles, poor circulation, and in severe cases, deep vein thrombosis, a condition where blood clots form in your legs and can travel to your lungs. That is not something to take lightly. Then there is your spine. While a recliner might feel supportive at first, it does not allow your spine to fully relax and decompress the way lying flat does. Your lower back stays partially engaged, your hips and core muscles never fully release, and over months or years, this can lead to chronic stiffness, muscle weakness, and balance issues. Here is the kicker. Sleeping in a recliner often prevents you from reaching the deeper stages of sleep. Your brain and body need those deep restorative cycles to repair tissue, consolidate memories, and reset for the next day. Without them, you might sleep for 8 hours and still wake up feeling like you barely rested at all. Geriatric rehabilitation specialists often warn that prolonged recliner sleeping can accelerate physical decline, especially in older adults. It is not that recliners are evil, they are just not designed to replace a proper bed for long-term sleep. So, if you have been living in your recliner at night, it might be time to reconsider. Your legs, your spine, and your energy levels will thank you. All right, I know what you are thinking. So everything you have been doing is wrong, and what am I supposed to do? Sleep standing up? Don't worry, I have you covered. Now that we have talked about what not to do, let's flip the script and talk about the sleeping positions that can actually help you wake up feeling like a human being again. These are not complicated, they are just smarter. Let's dive in. Better sleeping position number 1, side sleeping with a pillow between your knees. This is hands down one of the simplest, most effective changes you can make. Side sleeping is already a great choice for most people. It keeps your airways open, it supports spinal alignment, and it is especially beneficial if you snore or have sleep apnea. But here is the upgrade: place a pillow between your knees. Why? Because when you lie on your side without support, your top leg pulls your pelvis out of alignment, which twists your lower back and hips. Over time, this can lead to stiffness and pain. A pillow between your knees keeps your pelvis neutral, your spine aligned, and your hips happy. Bonus points if you sleep on your left side. Research from the Cleveland Clinic suggests that left side sleeping can improve circulation to your heart, reduce acid reflux, and even support better digestion. It is a small shift with surprisingly big benefits. And if you are someone who tosses and turns, do not stress. Even spending part of the night in this position can make a noticeable difference in how you feel in the morning. Now, side sleeping is fantastic, but what if you are a back sleeper at heart? You do not have to give it up completely. You just need to make one simple adjustment that can change everything. Let's talk about elevation. Better sleeping position number 2, elevated back. Sleeping, head and knees slightly raised. Remember how we talked about the risks of lying flat on your back? Well, here is the fix. Elevate your head and knees just a bit by propping your upper body at a gentle 30-degree angle. Using a wedge pillow or an adjustable bed, you are using gravity to your advantage. Your airways stay open, reducing snoring and sleep apnea episodes. Stomach acid stays where it belongs, so you wake up without that burning throat feeling, and your heart does not have to work as hard, which is especially important as we age. Adding a small pillow under your knees takes it one step further by releasing tension in your lower back. It is like giving your lumbar spine a little hammock to rest in. This position is a game changer for people dealing with acid reflux, breathing issues, or chronic back pain. And honestly, it just feels more comfortable once you get used to it. All right, we have covered side sleeping and elevated back sleeping, but there is one more position that combines the best of both worlds, and it is especially great if you want to feel like you are being gently cradled by your bed. Let me introduce you to the starfish. Better sleeping position number 3, the starfish, back sleeping with arms out. Picture yourself lying on your back, arms gently spread out to the sides, palms open, body relaxed. This is the starfish position, and it is one of the most underrated ways to sleep. Why does it work so well? Because it gives your shoulders, chest, and upper spine room to breathe. When your arms are down by your sides or tucked under your pillow, you are compressing nerves and restricting blood flow. But when you let them relax outward, everything opens up. This position is especially helpful for people who wake up with neck pain, shoulder stiffness, or numbness in their hands. It improves circulation to your upper body, reduces nerve compression, and allows your chest to expand fully for better breathing. Just make sure you are using a supportive pillow that keeps your neck aligned with your spine. A contoured or cervical pillow works great here. And if you are worried about looking silly, hey, starfish are graceful creatures. Own it. Okay, last one. And honestly, this might be my favorite because the ultimate blend of comfort, safety, and healing. It is called the 45-degree side recline. And for a lot of people, especially those dealing with multiple health concerns, this is the sweet spot. Let me break it down. Better sleeping position number 4, the 45-degree side recline, the true sweet spot. Imagine lying on your side, but instead of being completely flat, your upper body is gently elevated at about a 45-degree angle. You have a wedge pillow or adjustable bed supporting your back, a pillow between your knees for hip alignment, and another pillow cradling your head. This position combines everything we have talked about. It keeps your airways open, reduces acid reflux, supports spinal alignment, and improves circulation. It is especially beneficial for people dealing with arthritis, osteoporosis, heart conditions, or breathing issues. Research published in Geriatric Sleep Studies has shown that this posture can reduce acid reflux episodes by up to 70%, improve lymphatic drainage, which helps your brain clear out toxins overnight, and promote longer, deeper sleep cycles. It might take a night or two to get used to, but once you do, the difference is undeniable. You wake up clearer, more energized, and without that achy, stiff feeling that usually takes half the morning to shake off. Here's the thing, sleep isn't a luxury. It's not something you squeeze in between everything else. It's the foundation of everything: your energy, your mood, your focus, your immune system, your long-term health. And the position you sleep in plays a much bigger role in all of that than most people realize. You don't need expensive gadgets or a complete bedroom overhaul. Sometimes all it takes is a pillow between your knees, a slight elevation, or a shift from your stomach to your side. These tiny tweaks can add up to fewer aches, sharper mornings, and a body that actually feels rested when you wake up. So, tonight, before you crawl into bed, take a moment, think about how you're positioning yourself. Are you setting your body up for healing, or are you unknowingly adding strain? The choice is yours. And the good news is, it's never too late to make a change.